I had, from the beginning of using opiates, I was overdosing continually. There was the first time that I was, the ambulance had to call. They clearly told me they were ready to pull the sheet over me. They Narcaned me the third time, and I came to. And that was very scary. I was treated by the nurse kind of like, because I was soaking wet, and I had to undress and put on another garment. And she clearly expressed the fact that she felt like she was going to catch something from me and that I was like a diseased person, and it was a lot of guilt and shame. And I used walking home. I used continually after that.
What family members really ought to know about substance use disorders and how we've come to think about them over the last couple of decades is that it pretty clearly is an illness, meaning that there is predictable pathology, particularly in the brain, that is associated with the pathology of a use disorder or addiction. And it's often relapsing, remitting, and a chronic issue. It's actually fairly unusual for that first run at things by way of recovery to be the successful one or the one that takes.
We can try to help you to lower the risk of relapse by using these medicines. But nothing is perfect, and that's okay. We have to understand it's a process. It's not a quick fix. And I tell every patient, this process is one in which relapses are expected. Relapses are not a failing. Relapses are part of the recovery process.
But in the past in particular, I think it was quite common to see individuals coming back again and again for substance-related issues, and for the knee-jerk response to be, "What an idiot. Why don't you just stop that?"
As physicians, pretty much by and large, we are not people who are used to failing. And we see people who have relapses as being a failure. Either I didn't approach you the right way or I didn't give you the right medications. But I think the thing that we don't take into account is that it's not just me and my treatment of you, it's really how you're gonna respond to it, and then how we're gonna form a therapeutic alliance and work together to help you get better. If there's a failure, it's not always because I failed, it's because that alliance wasn't there or you weren't ready to accept it.
Recovery takes time in terms of the recovery of the brain from that illness and moving toward greater functionality in life. And we know that based on imaging studies and the amount of time that it takes for recovery to occur that's then associated with improvement in function. It's not a matter of days or weeks, it's a matter of months at least.
In addiction, like with any chronic diseases, there's good times and bad times. With major depression, with bipolar disorder, there's good times and bad times. With rheumatoid arthritis, okay? There are times of active disease and there are times where it's more quiet. And the goal of chronic disease management, what's the goal? Reduce the frequency of relapses, reduce the severity of relapses, increase the duration of periods of remission, and increase the quality of life during spans of remission. That's what you do for rheumatoid arthritis and for diabetes, and that's what you should do for addiction.
What it comes down to is the rapport that you develop. And as an emergency physician, that's one thing we have to be good at. I have maybe 10, 15-minute increments to actually see patients. In that time, I have to let the patient know that, number one, I'm there for you. I'm here to help you with your problem. And number two, it doesn't matter what that problem is. Whatever you're here for, that's what I'm here to help with.
Don't give up on yourself. Don't give up on your patients. Don't give up on the system. I think the future can either look bleak or it can look very bright, depending on where you choose to put your perspective. And nothing is over until the ultimate over. There's always another tomorrow. There's always another day. There's a chance that you will be the impact player, whether you're somebody who's in recovery, if you're a physician, if you're a nurse, if you're a paramedic, if you're a police officer, you might be the person that day who finally flips that switch and turns on the light bulb for somebody else who's going through this. Don't give up. Don't give up on yourself. Don't give up on anybody else.
If I had one message to give to the doctors and the nurses and the staff that work tirelessly in the ERs, that, you know, they're seeing just a very small portion, right, of the person that's coming in, maybe more than once, I would say thank you for not ever giving up on me, and thanking them for not ever giving up on this person that's here right now. Because I've witnessed, even just 2-3 days ago, an amazing, the way between the doctors, the nurse, and then the social worker, they just knocked it out of the ballpark with this girl, and I'm very grateful for that.